So our next in the sequence of 4-drawer trolleys is the hemorrhage control or trauma trolley, and it's probably the most complicated of the bunch. So it's again a 4-drawer trolley, and its aim was to try and remove some of the shelving based equipment used mainly for trauma. That was mainly located in the alcove, which we're hoping to remove entirely at some point. It's a 4-drawer trolley. There is a left-hand sided document holder and a right-hand sided consumables basket for intercostal catheters and other catheters, which I'll explain later. As for the other trolleys, we have some checklists in the document holder. There are checklists for the trolley itself, including a quick checklist and a weekly checklist, as well as a storage area checklist in a similar fashion to the other trolleys. We then have some clinical checklists, which are aid memoir for some of the big but infrequently performed procedures, such as thoracotomy, hysterotomy, canthotomy, and escharotomy. The right-hand side basket has a range of intercostal drainage devices from dwell caths through to pediatric and adult intercostal catheters, and there is also an 18 French indwelling catheter for use in hemorrhage control rather than in bladder drainage. On the top surface of the device, we've just got a little marker saying that there is some extra surgical equipment in the resus storage area, and I will identify this later. So in the top drawer, we have essentially equipment to suture and dress bleeding wounds. There's a range of pre-packed suture kit, compresses, dressing kits, Israeli bandages, and quick clot. Our second drawer includes pre-packaged surgical kit for a variety of uses. The most infrequently used will be our emergency surgical kits, which include kits for thoracotomy, hysterotomy, canthotomy, and escharotomy. We also have a maxillofacial hemorrhage control kit, which is used not for epistaxis, but for life-threatening hemorrhage. And then we have 2 pre-packaged chest drain insertion kits, which can be utilised for either open thoracostomy or chest drain insertion. We're encouraging the use of these Portex ambulatory chest drain bags, especially for those patients likely to be retrieved, as they're much easier for the retrieval services to deal with. The only little piece of knowledge about these is that the flutter valve has to be opened by flushing the system with 20 mils of air. As mentioned, in the resus cross-corridor storage area, there is some additional surgical equipment, including bladder retractors, umbilical clamps, and other spare equipment, including a rib spreading device. These are not absolutely necessary, but as I say, have been requested by specific operators to assist their practice. They are quite large pieces of equipment and so are kept across the corridor. Also within this box are equipment rolls, which we are testing, including the thoracotomy roll, which I will explain later. This is the rib spreading device. Our next drawer is our trauma drawer, which essentially has devices utilised to stabilise. So we've got 2 femoral traction devices, the CT6. Then we have a range of pelvic immobilisation devices, including the SAM splint and the T-pod. We also have some additional equipment, including a large trauma combine. We also have 2 tourniquets, the manual advantage tourniquet, and a large roll of cling wrap for use in burns. The 4th drawer is essentially a PPE drawer with gowns, gloves and masks. which we've all become a lot more familiar with, and is another receptacle for these items for use in some of these invasive procedures.